Hello, hi Tina, it's Ryan. This is my video C for upper extremity injuries exam 1. We're going to be continuing with some labrum tear tests. So the first two, only two of them, the first two are going to be the Kim test and the jerk test. So the Kim test, I'm going to have, she's already in the seated position, I'm going to have her seated in the position. I'm going to abduct her arm to about 90 degrees and I'm going to have elbow flexion to about 90 degrees as well. I'm going to have one hand on the humerus like this and the other hand on the elbow like this, and I'm going to apply a force driving the humerus this way and the elbow this way across the body. And if there is any pain or clicking with that, that could mean a posterior inferior labrum tear. So that's the Kim test. And then the jerk test is when you are also in the seated position, and instead this time you're going to have one hand on the shoulder and the other hand is going to be here, and you're going to have the abducted at 90 degrees, the shoulder abducted at 90 degrees and then internally rotated as well. And then I'm going to hold on to the elbow like this. I'm going to provide an axial pressure this way, and I'm going to horizontally abduct the arm, like she is punching something. Boom, across the chest. And if there is pain or if there is like a sudden jerk or clunk while the humerus is subluxing across that, or subluxing posteriorly in that direction, then that's indicative of a positive test, and that could also be indicative of an anterior posterior inferior labrum tear. The last three tests are all instability tests, and they kind of go hand in hand. So the very first one I'm going to do is the apprehension test. So I'm going to have my patient go into supine. I'm going to have her abduct her arm to about 90 degrees, and then I'm going to provide a shoulder support with this hand, and then I'm going to externally rotate the arm, and I'm looking at her face the whole time. If there is any apprehension during that test where she has like facial grimace or she like winces in pain, that's indicative of a positive test, and that could mean anterior shoulder instability. So next I'm going to do the Job relocation test, and for this one I'm going to have one hand on the wrist and the other hand providing an axial load on top of the humerus, and I'm going to, if I'm able to externally rotate more, or if the pain is actually relieved or alleviated during this procedure or during this test, then that's indicative of a positive test, and that means that could also mean that there's anterior shoulder instability. And then the last one is the surprise test. So you're going to have the patient in the same exact spot as the Job test, and you're going to release this load that you're giving on top of the humerus. And if she winces in pain as soon as I surprise her with that, I'm going to let go. Then that could be indicative of a positive test, and that could also mean anterior shoulder instability.